Ending AIDS, that means to me that we know today that's possible. We know today that's possible with the tools that science has delivered during the last 30 years. We have diagnostic tests, we have made progress regarding rapid tests, we made progress regarding treatment, we have antiretroviral treatment that bring a lot of benefit for individual benefit for the patients. We know that it decreases more than 85% the mortality of the patient, but in addition, since now last year, we have the final evidence that the treatment is also prevention. We know that the treatment, when the people are treated early, then they do not transmit to others. So if you consider that the treatment is also prevention, that means, and according to the model, mathematical model, we must be able to stop the AIDS epidemic by 2050. However, of course, we are all pushing for the universal access to treatment to all. We know that we have made enormous progress. Today we have 8 million of people on treatment everywhere in the world. We need to do better. We need to do better, and the reason why there is the main message of this conference here is to try to say to the decision maker, look, we made this progress. We cannot stop it. We should continue. We should continue. Meanwhile, science can continue to work. Scientists can continue to work and to try to have a vaccine, which will be one additional component for prevention. And we need to have alternative therapeutic for the future. It's the reason why at the IAS we launched this HIV cure initiative 2 years ago in order to accelerate research on novel therapeutic strategy for the future, aiming at least to have a treatment that the patients can stop, so it will be less costly. It will be less problem of adherence to the treatment, which the treatment today is a lifelong treatment. Less complication. There is a small proportion of patients on long-term life treatment that show complication. So we need to continue both implementation of the tools that we have in our hand today and to continue science in order to bring the novel therapeutic approaches for the future and also the vaccine.
As a scientist, when you look back a little, what do you see, what kind of really important breakthroughs during these 30 years?
The main important breakthrough has been, of course, the treatment. Because as I said, it's clear that treatment is not only a treatment, it's also prevention. So, I mean, this is the main breakthrough. Of course, we got this combined treatment in 1996. All over the year, since 1996, we are seeing now the benefits, the long-term benefits of this treatment. And we knew since the mid-90s that the treatment was already prevention for mother-to-child transmission. So one of the critical objectives today, and the United Nations decided that we should do it, elimination of mother-to-child transmission by 2015. That is feasible.
When you look on there is a world economic crisis, the need of funding is still big for HIV and AIDS. How do you see this conflict?
It's a terrible conflict, as you said, but you know that it has been studies and research made showing that the treatment for HIV patients is cost effective. There are several studies reported in the literature showing that if you treat the patients in countries strongly affected by HIV, there is effectiveness for the country because the people are in age of working. So if they are sick, of course they cannot work. And in addition, of course, you have all the care for the patients, which is very expensive as well. So it's the reason why several studies made clearly show that if you treat, it's cost effective. So we should continue. Otherwise, we are going to lose all the benefit that has been made all over the year. We are starting to see that if you treat HIV, if you implement the treatment and organize the health system in the country, there is a benefit not only for HIV, but it's also a decrease in tuberculosis in those countries. So it's the global health of those countries which is improving.
Now you are becoming president for 2 years until Melbourne 2014. What would you like to focus your energy on these 2 important years?
You know, as a Nobel Prize, it's a wonderful honor, and you know, I feel a lot of responsibility. I feel that I can be the voice. I can be the voice of the HIV/AIDS community. When I'm speaking about community, I mean everybody. Patients, of course, first, the scientists, the health professional, and what I would like to do during these 2 years is to use this voice for the decision makers, to try to convince them how much important is to continue their commitment, to be the voice for the justice and the respect of human rights for the key affected population, MSM, IVDUs, but also the voice for the woman. So I am a woman myself, so I think it's important for the woman to benefit of equity, less violence for the woman. I think it's very important to be considered. And of course, as a scientist, I would like also to continue to be a voice to try to accelerate research for cure, accelerate research for vaccine.
When you go into the future, do you also think it's important to know and understand the history of HIV and AIDS?
The history of HIV and AIDS is very important, of course. You know that the IAS, we say always that the IAS stronger together against HIV. And if I look back in the early 80s, we were quite fast after the discovery of the virus to develop the diagnostic test and then to have the first treatment, AZT, showing that we can prevent mother-to-child transmission by monotherapy, and then to have the antiretroviral treatment in '96. How we have been so successful in only a few years is because we were working all together. So it's really something that I would like to push today as president of the IAS, to work better together as we did in the early years. It's the HIV Cure initiative. It's really the way we do, is try to stimulate, to promote network of collaboration at international level, globally. Multidisciplinary approach. It's very important, to involving of course, scientists, social science, biomedical science, but also communities. We have to work together if we want to be successful for the new tools that we will have for the future.
Are you optimistic?
Oh yes, I am. I'm optimistic because I can see, probably we feel that now that we know that with the current tools that we have, we can turn the tide against HIV, against AIDS. So I feel like I felt in the early years of HIV, an atmosphere of solidarity, mobilization to end the AIDS epidemic. So I think it's a good time to do that, even if we know that it's not a good time at the financial level, but we know also that when we work better together, it's less costly.